10 silent stroke signs you should never ignore. Strokes are often associated with sudden, noticeable symptoms such as slurred speech or weakness on one side of the body. However, not all strokes present with obvious signs. Silent strokes, also known as silent cerebral infarctions, SCIs, occur when blood flow to a part of the brain is blocked, leading to damage without causing outwardly apparent symptoms. While these strokes may not cause immediate disability, they can still have serious long-term consequences if left untreated. Recognizing the signs of a silent stroke is essential for timely intervention and prevention of further damage. Here are 10 silent stroke signs you should never ignore. Memory loss or cognitive decline. Difficulty remembering recent events or conversations, as well as changes in cognitive function, such as trouble concentrating or solving problems, may be signs of a silent stroke affecting areas of the brain responsible for memory and cognition. Sudden changes in behavior or mood. Abrupt changes in mood, personality, or behavior, such as increased irritability, depression, or anxiety, could indicate underlying brain damage from a silent stroke. Balance and coordination problems. Unexplained dizziness, loss of balance, or difficulty coordinating movements may be subtle signs of a silent stroke affecting the brain's control centers for balance and motor function. Visual disturbances. Silent strokes can cause visual changes such as blurriness, blind spots, or difficulty seeing out of one eye. These symptoms may come and go or persist over time. Fatigue or lack of energy. Persistent fatigue or a sudden decrease in energy levels, especially if there's no apparent cause, such as lack of sleep or physical exertion, could be a warning sign of an underlying silent stroke. Headaches. While not all headaches are indicative of a stroke, sudden, severe headaches or migraines that differ from usual patterns may signal an underlying vascular issue, including a silent stroke. Numbness or tingling. Numbness, tingling, or a pins and needles sensation in the face, arms, or legs, particularly on one side of the body, may indicate nerve damage caused by a silent stroke. Changes in speech patterns. Subtle changes in speech, such as difficulty finding the right words or articulating thoughts clearly, can be early indicators of a silent stroke affecting language centers in the brain. Sleep disturbances. Persistent insomnia, disrupted sleep patterns, or excessive daytime sleepiness may be associated with silent strokes, especially if other risk factors are present. Sudden incontinence. Loss of bladder or bowel control without a clear explanation could be a sign of neurological dysfunction caused by a silent stroke. It's crucial to note that these signs may not always be indicative of a silent stroke and could be attributed to other underlying health conditions. However, if you or someone you know experiences any of these symptoms, especially if they're sudden or unexplained, it's essential to seek medical attention promptly. Diagnostic tests, such as brain imaging studies like MRI or CT scans, can help detect silent strokes and guide appropriate treatment and preventive measures. Preventing silent strokes involves managing risk factors such as high blood pressure, diabetes, high cholesterol, and smoking, as well as adopting a healthy lifestyle that includes regular exercise, a balanced diet, and stress management techniques. By being aware of these silent stroke signs and taking proactive steps to address risk factors, individuals can reduce their risk of experiencing long-term consequences associated with silent strokes. Remember, early recognition and intervention are key to preserving brain health and overall well-being.